Good evening. Welcome to Columbus Aesthetic and Plastic Surgery. We're so thankful for your time, energy, and efforts this evening. While we look forward to absolutely welcome you here in the practice when the time is right for our events, because they were really super fun. We know this is our next best thing. So we do appreciate you logging on this evening and taking the time to learn about our hair restoration program here at CAPS. I'd like to introduce myself. My name is Jennifer Heck. I've been involved in the practice almost about 20 years now. And shortly you'll be hearing from Olivia Rudman, our amazing physician assistants who we're happy to have here in the practice with us. A slight overview of what you're going to be listening to over the next 20-25 minutes is we've sort of broken up the presentation in two parts. So Olivia's going to cover non-surgical options where it's not in an operating room or in a surgery suite. And then I'll take back over and explain Neograft hair transplantation. So Olivia is going to join us here and start off by giving you an overview of the hair growth cycle and go into non-surgery options. And I'll see you back here in a few minutes. Thanks, Olivia.
Thank you. Hi guys, I'm Olivia. I just wanted to thank you as well for joining our hair restoration event. We're so excited about the treatment options that we have here at CAPS. I first wanted to start though going over the hair growth cycle. So as you can see on the screen, we have a couple different phases. The anagen phase is the active phase of the hair cycle. That's when the follicle is connected down to the dermal papilla, which is that structure down there at the bottom. It's such an important structure. It gives that follicle the blood supply, the oxygen, and the nutrients that it needs to grow and stay active. So that phase lasts for 6 to 7 years. So it's a pretty long phase. And then it transitions into the catagen phase, which is just the transition period into the telogen phase. The telogen phase of the hair cycle is an important phase. What happens is the structure disconnects from that dermal papilla, so the hair follicle is not receiving any oxygen, blood supply, or nutrients. The hair strand will hold on to the follicle itself for a couple of weeks, and then you'll go through a process of shedding. So it is very normal to shed your hair. The American Society of Dermatology says it's normal to shed up to 150 strands of hairs a day. That's a lot of hair. However, when you start to notice more thinning, maybe widening of your hair part, maybe some patchy spots of hair loss, that's an indication that maybe something else is going on with the hair cycle. So a couple different causes of hair loss that I want to cover. Most commonly, stress, hormones, aging, diet, thyroid imbalance, weight fluctuation, all of those things can play a role in the hair loss. Men typically will notice a receding hairline, maybe they have a bald spot on the crown of their head. Women will notice a widening of their hair part, maybe you notice that you're thinning in the temporal area of your scalp, or just feeling like overall your hair is just feeling thin and dull and lifeless. So a couple different non-surgical treatment options that we have here at CAPS. We have our CAPS hair care system, which is a phenomenal system. I'll cover here in just the next slide. Low-level light therapy and PRP, and then again, Jen will address the Neograft, which is our surgical option later on. So our hair products, these are brand new to CAPS. We're super excited about them. There's a lot of clinical studies that stand behind them. They're all natural, organic, vegan products, so no harsh chemicals. Their goal is to help protect and nourish healthy hair growth. They help with the anchoring of the dermal papilla, which if you recall is that little hair structure that helps give those oxygen and nutrients to the follicle. And it's also clinically proven to reduce the production of DHT. So DHT is a derivative of testosterone, which is a hormone that all of us have in our body, including females. So when you reduce that DHT, you just create a healthier environment for your hair follicles and overall healthier head of hair. Low-level light therapy. So I first want to cover what the mechanism of action of this therapy is. The goal is to stimulate the mitochondria of the cell, which is the powerhouse portion of the cell. That's what gives that follicle the energy it needs. It helps strengthen a weakened follicle, helps remove that harmful DHT and create an overall healthier environment. It also increases that blood supply, oxygen, and nutrients to that scalp area, so you just have an overall healthier hair follicle. As you can see on the right-hand side, that low-level light therapy is able to penetrate down into the scalp to the depth of the hair follicle. It's important to differentiate this between LED lights. LED lights are great for the surface of the skin. They're great with acne, scarring, all of that, but they're not strong enough to get to that follicle. So it's important when you're looking for low-level light therapy that you're looking for something that has true red light. So we are very excited to now offer the Synetics laser therapy here at CAPS. But as said before, it's important to help heal that follicle. These treatments are really relaxing. You come into the office, they're 30-minute treatments. We provide coffee, tea, water, soda. It's really a time for you to decompress and help nourish your scalp. There's no pain and no side effects. So I think a lot of times when we say laser, people think of maybe laser hair removal or facial treatments, which can have a little discomfort. This does not hurt at all. So it's just a little red helmet that goes right on top of your head. You don't need to use any numbing cream or take any anti-inflammatories or anything like that, and it's very safe and effective. So here are a couple before and after photos of our Synetics laser therapy. As you can see, a lot of these people dealt with generalized thinning and hair loss, especially on the top of the head. And you can see really these results speak for themselves. They do a great job at thickening and helping with that hair growth. PRP. So PRP stands for platelet-rich plasma. This is used in a lot of different areas of medicine. It's used in aesthetic medicine, hair restoration, orthopedics. It's really great because what we're doing is we're drawing your blood, we're spinning it down in the centrifuge. That centrifuge separates your red blood cells from your platelets. And those platelets contain a high concentration of growth factors and proteins in them that are necessary to help with the healthy, healing, inflammatory process that goes on in your body. So it helps with blood flow, it helps with nourishment on the oxygen and nutrient level to the surrounding hair follicles. So I want to address the 3 goals of PRP injections in the scalp. So firstly, again, capillary formation. So when you have more blood supply and circulation, you're bringing more oxygen and nutrients that your hair follicles may need. Also helping thickening existing hair. So as you can see in these 2 patients, both of them had generalized thinning and hair loss. And after 3 PRP treatments, they really had thickening of that existing hair and growth of miniaturized follicles. So I'm excited to say during your complimentary consultation, you'll receive scope photos. So what those scope photos do is they actually look at the hair follicle on the microscopic level. And during your consultation, I'll explain exactly what the scope is showing, but we really look at the health of the follicle by the width of the hair strand, the density, and we also look for any signs of inflammation, whether that be redness, scaling. It's going to be great during your consultation. So that brings us to a couple of treatment packages that we now offer here at CAPS. Our first package is the liquid gold package. This is if you want to just focus just on PRP. So we recommend a series of 3 PRP treatments, 4 to 6 weeks apart. We then will transition you into a maintenance program. That maintenance program starts at 1 treatment quarterly, so every 3 months. You'll also receive a set of CAPS hair products. So if you remember, those products are all natural. They're clinically proven to aid in hair loss, and they help remove that harmful DHT that may be causing some of your hair loss. The next package is Radiant Hair. This is focusing just on the Synetics light therapy. There are 48 in-office treatments, and again, those treatments are comfortable. It's really a time for you just to unwind, relax, and let us do the work with the hair, and also a set of CAPS hair care products. The Nourish and Restore package is the best of the best that we have to offer here at CAPS non-surgically. That contains a series of 3 PRP treatments, a set of our CAPS hair care products, and then also 48 in-office treatments with the Synetics laser. So what we'll do during your consultation, again, we'll address what exactly you've been experiencing. We'll look at your scope photos and determine what package is necessary to meet your needs and your goals, and really come up with a customized treatment plan that's gonna work for you. So that brings us into Neograft, and Jen is going to take over from here. I look forward to seeing you in consultation.
Thanks, Olivia.
Thank you.
So hopefully that gives you a really nice brief summary of the non-surgical options. And just rest assured, I think the big thing is to know, I love webinars and I love information, but honestly, everything is individualized, and we will absolutely customize each and every treatment plan according to what you need and what your goals are. So as we transition into surgical, I like to preface it with Yes, sometimes, some cases, of course, Neograft is the only option if you have empty hair canals. So when we reference those scope photos, and we know that if you're experiencing hair thinning and significant hair loss in areas, sometimes those non-surgical things just cannot achieve the goals that you may want to achieve. So even when we start talking Neografts, sometimes our hair transplantation clients are still doing some of these non-surgical things, because you have to remember, even when we do the implantation, hopefully if you have a little marriage between your native hair or hair that is still on the frontal hairline, the mid scalp, and the crown, we still want you to maintain your healthy, normal, natural hair, but maybe we would augment with Neograft. So sometimes it's a marriage of both non-surgical and surgical, but then I'll transition into more of like, what does that Neograft candidate look like, and sort of what would our goals be? Neograft is a device. It's actually the name of the device we use to harvest the follicles during FUE, or follicular unit extraction. It's a hair transplantation method that we've been using since we embarked on this hair restoration program here at CAPS, and we've had tremendous success with it. It's extremely gratifying because people are just happy. What happens is we remove the donor hairs, which come from the back of the head, because men are genetically predetermined not to lose hairs in the back of the head. So think of it from ear to ear. The base of the crown to the nape of the neck is where we get the donor hairs. The donor hairs then are transplanted up where we decide, of course, prior to the surgery day and the morning of. We draw the hairline that we're going to create, and we all decide on that plan right before we even get started. So it's a during your consultation, we discuss it. We often do a preoperative visit to do final planning, and then the morning of, we confirm everything and move forward. Good candidates are people who are generally healthy, and someone looking to restore their natural hairline, create more thickness, more density, perhaps put hair where there is none. And people come to us with all variety of issues, sometimes thinning, sometimes no hair, and we can always discuss what the expectations are during your consultation. So I think the really fun thing is, let's go over expectations. I feel like the best way to illustrate Neograft's success is to show you some of our own real clients. None of these are marketing photos. And actually, yeah, Olivia had our own PRP clients as well in her previous slides, because we love sharing our patient story. So this 35-year-old on the photo on the left, this is how he presented, and he just really wasn't wearing his hair grown out at all because he didn't like how thin it was. He had patchiness and he didn't love the hairline. So in the second photo, I like to share that 1 week because it just helps illustrate his hairline where the grafts were. So what you're actually seeing is small, tiny little pin, like it's a 1 millimeter, so it's like the size of the tip of your pen, and those are individual follicle, the little scabs. It's like when you scab your knee as a kid. You scab for about a week or two after Neograft, and that helps you see where the hairline is, and then you can see his outcome 6 months later. So extremely gratifying, of course. I'm very excited to share this client who gave us photo consent. I actually just had his 5-month follow-up last week. And I love sharing this. He's a young adult. He's 22 years old. He was able to have a treatment plan of 2,500 to 3,000 grafts. During that day, we were able to get around 2,700, you'll see there. So he just, at a very young age, he said really honestly from 18 and up, he was experiencing thinning, excessive shedding. And over the last 2 years, he just already knew his trajectory. Unfortunately, genetically, he is gonna, he has male pattern baldness. So the scabs and that presentation in that middle photo shows you where his hair transplanted follicles were laid. And then very excitingly, 5 months later, he's just super excited, feeling a lot more confident, excited to share and give us photo consent to share his journey. So he's heading back to college this spring, and definitely just feeling a lot more happy about how he's presenting day to day. So, and some people may ask me, is there an age limit? And honestly, I would say young adult, young 20s is about the youngest we generally do. Depends on how you present and what your goals are and what their experience and how the hair thinning and the reason for that. So we always decide that during consultation. And honestly, there's no age limit on the vice versa. usually it becomes in the 60s or older. It's just making sure your medical history has no contraindications. And of course, we go through all that in your consultation. This is a lovely result, and it's a great opportunity to share with you what 2 transplants could look like. In your lifetime, in general, if a gentleman has a donor site that is strong with dense hairs and thickness, we can generally do 2 neografts in your lifetime. So this client here was looking to reinforce his frontal hairline and the temporal area. That middle picture here is 1 year after his first transplant. So you can see that hairline is really nice, it's improved, and he was seeking a thicker, more dense hairline, and that's where we focused again on the second transplant. So we were able to catch his photo 8 months after the second transplant. So if you're really looking at that frontal hairline, you can see what a wonderful progress we were able to make. These are the exact same clients, same interval, and you can see that chin to chest photo is just a really beautiful change in the density, the thickness, and the presentation. So I'm sharing this photo because his hair type is different. So this 43-year-old gentleman had come, and when you see that photo and he's tucking the chin to chest, you know, he was looking to help create more coverage, help with the thinness of his hair, the density, and help with the hairline. So I'm going to show you 2 slides for him. This is his photo, obviously 10 months later. So you can see the neografted hair is coming in, and we got really nice coverage. His hair is a bit thinner than that previous example. Just by nature, that is his hair type. So we always have those conversations prior. And in general, at this point, because we're so many years in, I can share with you, you know, whatever your hair presents like, we can show you a photo that relates to your specific hair type, tone, texture, thickness, etc. He was able to do 3,000 grafts in 1 neograft. And then I like to share with you his posterior, or that crown view, because when you can get up to about 3,000 grafts in a transplant, sometimes that's a game day call between 2,500 and 3,000. We were able to spread some of the grafts on the crown. It would not be as thick as the front, which was our primary area. And this way I can show you, okay, when you can get up to 3,000 grafts, you can get some coverage if you have loss from the crown to the front. He actually just had a second neograft about 6 weeks ago, so we're really excited to see what happens to him over the next year. This is a lovely 45-year-old client who did 2,000 grafts and was just focusing only on the frontal hairline. I love this story because it's not unlike what I hear with a lot of clients. He never wore his hair grown out. He said for years and years and years, because of the patchiness, the thinness, the inconsistency of how his hairstyles would present, he would just shave his head, literally. And he said he would have to shave his head almost every 2 to 3 weeks. 10 months later, especially when he came in first follow-up, it's very exciting because he wears a nice hairstyle, and he's really happy with his outcome. The next client, 54 years old, and I wanted to share him in case you at home are resonating or just wanting to see more of a salt and pepper. And he had a little bit more significant loss when he came in. And so our goal with him was to help restore and give him confidence on that frontal hairline. So he did 2,500 grafts. And then I also have a photo of what he looks from that chin to chest view. So no, over the next 6 to 12 months, these should even get a little better. His follow-up was just here in the last, I want to say it was about 2 months ago. So we generally see all our post-ops at 1 week. Clients text me questions anytime. We're all access here. And then we generally do photos about that 6 months to 12 months. So this is just a really nice illustration for him to get hair. Pretty much, he had very few hairs to start with. And so we created a hairline that he felt confident with. And he's super excited. So this 29-year-old male did 2,000 grafts, and we focused, you can't miss, right? Like, it's just such a beautiful restoration of that frontal hairline and in that temporal area. We were really excited for him as well. This gentleman, he was able to have a treatment plan that included 2 neografts along the way. He had significant thinning and hair loss and was really hoping to achieve, a much more natural, more substantial hairline from the front to the crown. So to achieve that over time, the second photo is his second one, 6 months after his second Neograft. So again, that is possible. You may at home be wondering, do I always have to have two? Absolutely not. There's so many different scenarios when you come in for consultation, but please rest assured when you do come for your in-person consultation, we sort of we lay out that path, and by any means no one has to do a second. Sometimes that's just personal preference. It's just about the density that you want to create. So I would say about half and half of our clients do one versus two. This gentleman, we did 2,500 grafts and pretty much spread them throughout the mid scalp and the crown. And 6 months later, he had a really nice outcome. He was, of course, really excited about that. When we end up talking, we'll take questions here in a few minutes. Laura will let us know sort of what questions are coming in and sort of where we can hone in on what's sort of resonating or what you might want more information on at home. But we're super excited. When you come in for your consultation, it is no charge. You will see Olivia or I, and at that in-person consult, you will have, you'll get to leave with a shampoo and conditioner, which is really fun. We've never done that before. We're going to try and get all the consultations done by the end of February to get the event pricing. And so what we are going to be able to do is do 10% off any of the hair restoration packages that we would decide on. And then if you end up being more of a Neograft candidate where the non-surgical options wouldn't meet your goal, we're excited to say we are actually going to take $1,000 off Neograft. So that's super exciting. We're always happy to help and educate you, and we're very excited to have the opportunity, and we thank you. We know everyone has many choices. So I'm going to take off the PowerPoint now, and then Laura's going to let us know if we have any questions that we can help address from you at home or anything that needs further explanation. We're happy. We're all ears if we can help.
Jen, thank you so much. Jen and Liv both, that was fantastic. We did have several questions coming in. So Jen, I want to start with you because I had 2 Neograft questions come in.
Sure.
The first is, do I have to get a special haircut in preparation for my Neograft?
In preparation for Neograft, we actually will give you an illustration of I like to say the high and tight. So if you are someone who wears your hair longer, sometimes men grow out their hair and pull it back in a ponytail when they're thinning and whatnot, or pull it over. Just rest assured, we'll guide you on that. But I always say, think about sort of that military high and tight. Now the top can be as long as you have it. We can work around it. But the donor site is key. We have to have basically a 0 to a 1 guard haircut up the back where we're going to actually harvest the follicles. So that's a great question.
Perfect. Also for Neograft, another question, how many days out of work will I be after my Neograft?
So the Neograft procedure is a whole full day. You get dropped off, your loved one or your anyone who is willing to come pick you up, right? Because you are medicated. I always say 2 days minimum, depending on your work. So that is part of our discussion, because I will help guide you. If you're, more of a desk work, or if you're on Zoom calls, if you're in person, if you have a physical manual kind of job, we will discuss that. So I would say depends on the type of job, but I say at minimum 2 days, because you do have a pressure dressing over the donor site that isn't really like client friendly if you're at work. But I would say most of my clients really are back to work in 3-4 days.
Perfect, thank you. Now I actually had a couple questions referring to the PRP and the light therapy. If I could have Olivia back in the screen. Thank you, Liv. A couple questions on the PRP. One of these I'm going to combine. I had several questions on it. Is how many times a week do I need light therapy? And kind of along with that is how long does it take to get 48 treatments? And when the treatment is complete, do I keep doing it after?
That's a great question. So it's 48 treatments, but it is a stair-step program over the course of 6 months. So what we do is we start out the first 2 months, you're here 3 times a week, so every other day. And then the next 3 months, you're here twice a week, so it goes down. And then the last month, you're here once a week. We expect to see your results at 6 months. So there's a couple different stages. The first 2 months, we'll probably notice a decrease in shedding. From 2 to 4 months, we'll notice increase in hair quality. So your hair might feel softer, it might be shinier. And then really that 6-7 mark is where we expect to see actual hair growth. You don't need to come back for the 48 treatment regimen after that. If you need a touch up throughout the course, you can come in for a single treatment.
Perfect. And I think you had mentioned it, but how long does the light therapy treatment take?
Takes 30 minutes per session. And again, the treatments are really comfortable. It's really a time for you to unwind, relax. We have magazines available. You could bring a book, laptop. We have complimentary Wi-Fi. It's a great experience.
Perfect. And kind of in that same thing is how long does a PRP treatment take? How long will their appointment be?
So the PRP treatment takes about an hour. What we do is we draw your blood, we spin it down, which takes about 5-10 minutes. And then we will, talk about possible numbing processes. A lot of times we'll use topical numbing cream. That numbing cream will sit on the scalp for about 45 minutes, and then we do the injection.
Perfect. Also, I've had this question a couple times. Is PRP for males and females?
Yes, PRP is a great treatment for both males and females. So again, it really targets the body's own natural inflammatory process. So when we inject that PRP, which comes from your own body, it's helping stimulate that healing process, and it works in both males. It's great.
And lastly, this is well, let me preface this. This is the last question. We do have some more coming in, and I just want to make sure that everyone knows if we didn't answer your question live, we will be emailing you the answer. So if anyone doesn't get their question answered right now, just to be respectful of everyone's time, because I know it's been a long day for everyone probably, we will get back with you. So last question live is, what is the recovery time for PRP, and can I work out after?
That's a great question. So with PRP, there's very little downtime. A lot of people will come in and then they'll go about their normal day-to-day activities. You can get a mild headache afterwards just because there are injections into the scalp. So we recommend taking Tylenol. It's nothing that requires any pain medications. You're able to drive home by yourself. We do ask that you refrain from rigorous exercise and activity for about 24 hours after. And again, that's to minimize your chance of getting infection and also to keep the circulation at normal levels. We don't want to increase your circulation after a PRP injection.
And actually, I lied. One more quick question, because this is probably valid for all of us. When I do PRP, am I able to still have my hair colored?
Yes, that's actually a great question. So you can, but we ask that you do not color your hair for 2 weeks following the treatment, just to decrease any chance for potential complications, because we are putting, multiple injections in your scalp. We don't want any of those chemicals going down to that injection site.
Perfect. Thank you both so much. This was a fantastic presentation. Again, we'll be getting back with everyone with the questions. And as well, we will be sending everyone a link to this presentation. So if you missed anything, you will be able to click on it whenever you want at home and watch the entire presentation.
Awesome. Well, thank you
so much.
Appreciate it.